Community health worker benefits, referred to as CHW benefits, were added as a Medi-Cal benefit as of July 1st, 2022. Under this benefit, approved services rendered by qualified CHWs are eligible for Medi-Cal reimbursement when rendered at clinics, including federally qualified health centers, commonly referred to as FQHCs, tribal FQHCs, rural health centers, commonly referred to as RHCs, and Indian Health Services. Also included are hospitals, community-based organizations, and local health jurisdictions, where no restrictions have been placed on the place of service. The CHW benefit comes with an array of guidelines, which we will review in detail today. Guidelines not only pertaining to the services that can be rendered by CHW, along with their billing, coding, and documentation practices, but guidelines on what makes a CHW eligible to render services, as well as patient eligibility guidelines. Prior to rendering CHW services to a patient, a written recommendation for the services is required by either a physician or by another licensed practitioner of the healing arts working within their scope of practice. Medi-Cal identifies licensed practitioners of the healing arts as physicians, physician assistants, nurse practitioners, clinical nurse specialists, nurse midwives and licensed midwives, as well as registered nurses, public health nurses, and licensed vocational nurses. Also, podiatrists, pharmacists, dentists, psychologists, licensed educational psychologists, licensed marriage and family therapists, licensed clinical social workers, and licensed professional counselors. It is the responsibility of the recommending practitioner to ensure that the patient he or she is recommending for CHW services meets the eligibility criteria that supports medical necessity for the services. With this said, let us review the patient eligibility criteria for CHW services. Medi-Cal patients are eligible for CHW services when one or more of the approved medical necessity and approved patient issue requirements have been met. The provider who recommends the patient for CHW services shall determine whether a patient is eligible for services by referring to two lists provided in Medi-Cal's guidance. One list contains the approved medical necessity requirements, and the other contains the approved patient issues allowed to be addressed by CHW. If a Medi-Cal patient who is younger than 21 has a parent or guardian who either is not enrolled in Medi-Cal or is not eligible to be a patient at the practice, but presents with one or more of the criteria that makes them eligible for CHW services, then CHW services can be rendered to the parent or guardian as long as the issue or issues being addressed are directly affecting the patient. Let us review these two lists, starting with the list of approved patient medical necessity requirements, where only one requirement needs to be present to support medical necessity for CHW services. To follow will be the list that pertains to the patient issues that can be addressed by CHW, along with the approved services that can be rendered by CHW to address them. First on the list of approved patient medical necessity requirements is if the patient has been diagnosed with one or more chronic health conditions, including behavioral health conditions, or has a suspected mental health disorder or substance use disorder that has not yet been diagnosed. Next on the list is if a patient has a medical indicator that does not yet warrant a diagnosis, but makes them at risk of a chronic disease. Examples of medical indicators provided by Medi-Cal are elevated blood pressure and elevated blood glucose levels. Also listed is if there is a positive adverse childhood event screening, commonly referred to as the ACEs. And also listed is if the parent or guardian is presently experiencing domestic or intimate partner violence. But it does not end there. Also listed is if there is a known presence of tobacco use or excessive alcohol use and/or drug misuse. Additionally listed is if there is a positive result of a social driver of health screening, also referred to as a social determinants of health screening, where there are unmet health-related social needs, such as housing and/or food insecurities. Also listed is if the patient has experienced one or more hospital inpatient stays, including stays at a psychiatric facility within the previous 6 months or if the patient is at risk of being institutionalized. Furthermore, listed is if the patient has had one or more visits to a hospital emergency department within the previous 6 months, as well as if they have had one or more stays at a detox facility within the previous year. Also included factors that would make a patient eligible for CHW services are if there are two or more missed medical appointments within the previous 6 months, if the patient has experienced needed support in health system navigation or research coordination services, if there is a need for recommended preventive services, and if the patient expresses a need for violence preventive services because the patient either has been violently injured as a result of community violence and or if a licensed health provider has determined that the patient is at significant risk of experiencing a violent injury as a result of community violence. If the patient has experienced chronic exposure to community violence, then they too will be eligible for CHW services. This ends the list of approved medical necessity eligibility requirements for CHW services, which brings us to the second list, the list of the issues that can be addressed by a CHW and the approved services they can render to address them. Once the patient demonstrates eligibility via their medical necessity by meeting at least one of the medical necessity requirements just reviewed, the next step is to identify the issues that are listed as recognized by Medi-Cal for CHW services, which are the need to control and prevent chronic conditions or infectious disease, if there are mental health conditions and substance use disorders, if the patient has a need for preventive services, if the patient has a perinatal health condition, if there are issues with sexual and reproductive health, and if there are environmental and climate sensitive health issues. Additionally listed is if there are child health and development issues, oral health issues, issues with aging, issues with injury, and if the patient has issues with domestic violence and violence prevention. Now that we know the medical necessity requirements approved to support patient eligibility to receive CHW services, as well as the approved issues a CHW can assist with due to the patient's medical necessity, we will now review the services CHWs are approved to provide to a patient. There are 4 categories of services a CHW can provide to address at least one of the approved patient issues, and they are health education, health navigation, screening and assessment, and individual support and advocacy. Let's examine these 4 categories in detail, where I will provide the services that can be rendered that fall under each. The first, health education, involves the CHW promoting the patient's health by addressing barriers to physical and mental health care, including providing information or instruction on health topics where the content of the education must be consistent with established or recognized healthcare standards. Health education may include coaching and goal setting to improve a patient's health or ability to self manage their condition or conditions. In the second category, health navigation, a CHW provides health navigation by providing the patient with information, training, or support to assist them in accessing healthcare by assisting in understanding the healthcare system and or to help them engage in their own care. It would involve the CHW aiding in connecting the patient to community resources necessary to promote their health and to address their healthcare barriers, including connecting them to medical translation or interpretation or transportation services. And it also involves assisting the patient with addressing their health-related social needs. Also under health navigation services, CHWs may serve as a cultural liaison or assist the licensed healthcare provider in creating a plan of care as part of the healthcare team. They also provide outreach and resource coordination to encourage and facilitate the use of appropriate preventive services. And CHWs can help patients to enroll or maintain enrollment in government and or assistance programs that are related to improving their health if such health navigation services are provided in accordance with the patient's plan of care. Moving forward, let us now review the third category of CHW services with a detail of the services that fall under this category. I am referring to screening and assessment. When a CHW provides services under screening and assessment, It is an indication that they can and are providing any screening and assessment service as long as the screening and assessment does not require a license to render. Providing screening and assessment services will assist the patient in connecting to the appropriate services needed to improve their health care. And the fourth and final category of service that can be rendered by a CHW is individual support or advocacy. Under this category, CHWs provide individual support or advocacy that assists a patient in preventing the onset or exacerbation of a healthcare condition, or provides support or advocacy that assists the patient in preventing injury or violence. And with regard to violence prevention services, all of the CHW services detailed under health education, health navigation, and screening and assessment can be rendered for violence prevention, as long as the services apply specifically to the prevention of violence. And remember, all CHW services may be provided to the parents or legal guardians of a Medi-Cal patient that is under the age of 21, as long as the services provided are for the direct benefit of the child in accordance with a recommendation from a licensed provider. Also, to serve as a reminder, these services can be billed under the child's Medi-Cal ID, and if the parent or legal guardian is not enrolled in Medi-Cal, then the patient must be present during the services provided. This concludes the list of medical necessity requirements and issues that will support eligibility for parents or legal guardians to receive CHW services. It also concludes the list of eligible categories of service, along with the CHW services that can be rendered under each category. Next for review are Medi-Cal's minimum qualification requirements for a professional to become a community health worker. Medi-Cal guidance advises of 3 categories of minimum qualification required for a professional to become a community health worker. These qualifications are lived experience, certifications with field experience, or work experience. Let's take a look at them individually so we can examine Medi-Cal's definition for each, starting with lived experience. Lived experience is an important qualification for a CHW. CHWs must have lived experience that aligns with and provides a connection between the CHW and the community or problem being served. The recognized lived experiences are incarceration, military service, pregnancy and birth, disability, foster system placement, homelessness, mental health conditions or substance use, being a survivor of domestic abuse or intimate partner violence or abuse and exploitation. And lived experience may also include the same race, ethnicity, sexual orientation, gender identity, or language or cultural background with one or more linguistic, cultural, or other groups in the community for which the CHW would be providing services to. Lived experience qualifications can help to determine which CHW would be a good match for a given patient. CHWs must also demonstrate minimum qualifications through either an approved certification or via a temporary work experience pathway. Let's review those now. For a professional to become a CHW, they must either possess a CHW certificate of completion or a violence prevention certificate. A CHW certificate of completion will allow the CHW to provide all covered CHW services, including violence preventive services. A CHW certificate of completion must be issued by the state of California or a state designee where the curriculum for the certification attests to the demonstrated skills and/or practical training in the areas of communication, interpersonal and relationship building, service coordination and navigation, capacity building, advocacy, education and facilitation, individual and community assessment, professional skills and conduct, outreach, evaluation and research, and basic knowledge in public health principles and social determinants of health as determined by the supervising provider. The certification program in which the CHW certification was acquired must have field experience included as a requirement. Also, a CHW must annually complete a minimum of 6 hours of additional training for any certification they possess. Next is the Violence Prevention Professional known as the VPP. The CHW must possess the VPP, which must be issued by Health Alliance for Violence Intervention, or they must have a certificate of completion in gang intervention issued by the Urban Peace Institute. A violence prevention certificate allows a CHW to only provide CHW violence preventive services, but a CHW that has a certificate of completion or has a temporary pathway to work experience can render all other CHW services as long as the temporary work experience pathway allows the professional to demonstrate their qualification. In the absence of a certification, work experience can serve as a temporary qualification to render CHW services, but Medi-Cal provides a few guidelines for those who will temporarily render CHW services under the work experience pathway. Let us review those guidelines now. Medi-Cal guidelines advise that if a professional has acquired 2,000 working hours as a CHW within the previous 3 years in either a paid or volunteer position and is working towards a certification, then he or she may render CHW services for a maximum of 18 months from the first CHW visit rendered to a Medi-Cal patient. In addition to the 2,000 hours, the CHW must have demonstrated skills and practical training in the areas in which they are providing CHW services. In addition to these guidelines, there are general and billing guidelines supplied by Medi-Cal for the compliant execution and billing of services. Let us review those now. Medi-Cal guidance indicates that CHWs require a supervising provider for the services they render to patients. Supervising providers must be licensed Medi-Cal enrolled providers who will directly or indirectly oversee the services a CHW delivers to patients, where those services delivered fall under the supervising provider's scope of practice and are billed under the supervising provider. The same list of providers that can recommend patients for CHW services, which I reviewed in the very beginning of this segment, are those providers eligible to supervise CHWs. The list of providers is located in the beginning of the billing and coding guide, found under Recommendation for CHW Services, listed as licensed providers eligible to supervise CHWs. Supervising providers can identify any additional training required by the CHW and/or can provide the additional training required when supervising. And although the list of licensed providers that can recommend CHW services to a patient is the same list of providers that are eligible to supervise CHWs, the supervising provider does not have to be the same professional who provides the patient's written recommendation for CHW services. Supervising providers can be based on your practice's clinical and/or administrative decision makers. In addition to pairing the scope of practice of the supervising provider's professional license to align with the CHW services he or she will be providing supervision for, Medi-Cal also advises that in addition to licensed Medi-Cal enrolled providers, supervising providers can also be a hospital and outpatient clinic. Additional Medi-Cal guidelines also advise that a local health jurisdiction or a community-based organization can be supervising providers, where a licensed provider does not have to be on staff. Medi-Cal's guidance does not offer specificity on how to bill for CHW services when rendered at local health jurisdictions or community-based organizations. Therefore, if a practice is interested in these billing guidelines, verification with Medi-Cal must be made at the site level. CHW supervising provider can bill for the services provided by the CHW, and there are 3 billing codes recognized by Medi-Cal for the reimbursement of services. The first, 98960, holds the description of self-management, education, and training, face-to-face, 30 minutes for one patient. The second, 98961, holds the description of self-management, education, and training, face-to-face, 30 minutes for 2 to 4 patients. And the third, 98962, reads as self-management, education, and training, face-to-face, 30 minutes for 5 to 8 patients. The billing for all 3 of these codes includes when the parent, caregiver, and family is present, with a maximum frequency of 4 units per code per day, which is equivalent to 2 hours of services for each. How did I reach that conclusion, you may be asking yourself? Well, let's take a look at each code's description to help us understand. The description for billing codes 98960 98961, and 98962 all state that they offer 30 minutes of services, indicating that each unit billed represents the reporting of 30 minutes of services. If Medi-Cal is advising that up to 4 units of service can be billed for each code, then they are indicating that up to 4 30-minute units are eligible for reimbursement, therefore recognizing up to 2 hours of service for reimbursement on each day. Additional units may be billed with an approved treatment authorization request, commonly referred to as a TAR, and TARs may be submitted after the service is provided. Medi-Cal also advises that there isn't a restriction placed on the place of service you are billing from, which indicates that services can be rendered in all clinic types, but FQHCs and RHCs should verify with Medi-Cal on if they will reimburse for services rendered to more than one patient per visit. Minimum documentation requirements for CHW services are as follows: the time spent rendering the service to the patient, and if coding and billing for 98961 and 98962, the number of patients receiving CHW services during the visit. Also, documentation should include the reason why the patient is receiving CHW services, as this will support its medical necessity. Additionally, the patient's condition should be documented and any barriers that are affecting the patient's health where the CHW services rendered are relevant to the condition and/or barrier. Also included should be documentation of the nature of the services provided, which must also support reasoning for the length of time spent with the patient. Medi-Cal provided an example of this in their guidance. Let us take a look at this documentation sample. Medi-Cal's example reads as, discuss the patient's challenges in accessing healthy food and options to improve the situation for 15 minutes, and assisted with the SNAP application for 30 minutes, and also referred patient to the XYZ food pantry. With regard to the time that CHW services can be billed for, Medi-Cal guidelines do not indicate that less than 30 minutes of CHW services are billable. Therefore, the time documented for services must reach or exceed 30 minutes. If the time not only reaches 30 minutes but exceeds 30 minutes, remember that each unit of service billed for is equivalent to 30 minutes. So if billing for 1 hour of services, 2 units should be reported. A CHW's documentation should also include the patient's recommendation for CHW services and why the recommending provider requested that the patient receive these services. The recommending provider's information should also be documented where a CHW's documentation must always be accessible to them. Additionally, a treatment authorization request should be located in the note, and also, if required, is a patient's plan of care, often referred to as a POC. A POC is a written document that is developed by one or more licensed providers to describe the supports and services that the CHW will provide to address the ongoing needs of the patient. POCs also come with a set of guidelines. Let's review them now. Medi-Cal guidance provides general guidelines for a patient's POC and information that must be included in the POC. A POC is only encouraged when providing ongoing or multiple CHW services to a patient, but it becomes required after 12 units of CHW services are provided. Each billable unit of CHW services is for the billing of 30 minutes. So billing 12 units of service would be equivalent to billing for 6 hours of CHW services. Therefore, if more than 6 hours of services have been rendered to a patient in a single year, then a POC is required, where the sum of this time must not include CHW services rendered in the emergency department. Each POC may not exceed a period of 1 year and should be reviewed every 6 months from its effective date by the licensed provider or providers who developed it. Upon the review, the licensed provider or providers must determine if any progress has been made towards the objectives listed in the patient's POC and whether CHW services are still medically necessary. If objectives have been met, the determination of discontinuing CHW services can be made by the licensed provider or providers. Medi-Cal guidance advises that the licensed provider developing the POC does not need to be the same provider that supplied the patient's initial recommendation for CHW services, nor does it have to be the CHW supervising provider. Medi-Cal's guidance only advises that the provider must be licensed, where the CHW may assist in the development of the POC. The POC must contain specifications of the condition or barrier that the service is being ordered for, and the services rendered must be relevant to the condition or barrier. It must also include a list of other healthcare professionals providing treatment for the condition or barrier, and written objectives that specifically address the recipient's condition or barrier affecting their health. And listed should be the specified services required for meeting the written objectives, which should include the frequency and duration of CHW services that will be provided to meet the POC's objectives. And now that we know services, documentation requirements, and guidelines, let us review those services that Medi-Cal guidelines advise that are not covered when rendered by a CHW. Medi-Cal guidance informs us that clinical case management or care management that requires a license is not a covered CHW service. Also, childcare, chore services, including shopping and cooking meals, companion services, and employment services are not covered CHW services. Additionally, helping a patient enroll in government or other assistance programs that are not related to improving their health as part of the plan of care is not a CHW services. And delivery of medication, medical equipment, or medical supplies are also not covered CHW services. Additionally, personal care services, such as homemaker services, respite care, and services that duplicate another covered Medi-Cal service that are already being provided to the patient, are not services covered by a CHW. Furthermore, transporting patients, services that require a license, and peer support services that are distinct and separate from those that are recognized to be eligible for delivery by a CHW are not covered when rendered by a CHW. And although CHWs may provide services to patients with mental and/or substance use disorders, CHW services do not include peer support services as covered under the Drug Medi-Cal program, Drug Medi-Cal Organized Developed Delivery System, and the Specialty Mental Health Services Program. And last of the services that are not covered when rendered by a CHW are services provided to individuals not enrolled in Medi-Cal, except for when the services are rendered to the parents or guardians of a Medi-Cal patient who is younger than 21, where the services are for the direct benefit of the Medi-Cal patient. And this, fellow travelers, brings us to the end of our travels on both the Dyadic Benefit Boulevard, where we examined its services and guidelines, and the Community Health Worker Benefit Boulevard, where we also examined its services and guidelines. I hope you've enjoyed this journey, designed to provide insight on coding and billing for these services. I have enjoyed compiling this information for you and presenting it to further support in your understanding of the many different nuances encountered with coding and billing for insurance carrier reimbursement. Today's travels brings our journey on the California Billing and Coding Guides Information Highway to an end. We've begun our journey in segment 1, where a review of all Healthy Steps aligned services in the guide was provided, up until smoking and tobacco use cessation counseling. We continued our journey in segment 2, where a review of psychotherapy services were delivered. Then there was segment 3, where we examined the comprehensive perinatal service program, including lactation services when provided outside of the program. Which brings us to this segment, segment 4, where we just reviewed the new Dyadic benefit and the community health worker benefit. Thank you so much for your interest in not only billing and coding for Healthy Steps aligned services, but for rendering these services, as together we can achieve improved outcomes for young children and families. Together, we bring focus to the important interwoven skills needed for families to foster healthy child development and lifelong well-being. And we must stand proud as we help transform the promise of pediatric primary care by promoting nurturing parenting and healthy development for babies and toddlers. I thank you for your attention, your time, and the opportunity to present today. Goodbye.